following segment is sponsored by the American Society of Hematology. New treatments for blood disorders like leukemia and sickle cell disease don't just happen overnight. They are the result of years of research. But proposed budget cuts to the National Institutes of Health could impact that research as well as patient care. Joining us now to discuss is the president-elect of the American Society of Hematology, Dr. Robert Negrin. Welcome to the show, Doctor.
Thank you so much for having me.
Of course, great to see you. Okay, let's start with the big picture. How does research from the National Institutes of Health impact everyday families?
Well, the National Institutes of Health, or the NIH, is the major source of research funding in our country that impacts the lives of all of us. The research funding from the NIH has developed new medications, new curative strategies, new preventative strategies for a whole host of diseases. What is being proposed in Washington is up to a 40% cut in NIH funding that could have a devastating impact on our ability to perform this research and to develop new therapies. And what we're asking your viewers is to consider advocating in support of NIH research by contacting their local congresspeople to advocate for to avoid these cuts and to maintain funding for the NIH.
Yes, absolutely. What would these proposed budget cuts mean for patients waiting on new treatments?
Oh, it could have a devastating impact on so many different things. But what we're most concerned about is that it could impact the development of clinical trials and new therapies that are ongoing and could put a halt to those trials. And it could also impact the research careers of young physicians, scientists, and doctors who are going into medical research. So we think this is of critical importance. I serve as the president-elect of the American Society of Hematology, which is an organization of physicians and scientists that are focused on conquering blood disorders, and NIH funding is absolutely critical to our mission. I, every day, take care of patients who are undergoing life-threatening, life-saving treatments for diseases like leukemias and lymphomas and multiple myeloma. And what my patients want is hope. They want a shot. And that's what the NIH provides, is new research to understand their diseases and new treatment options for my patients. And this happens all across our country. So it's important to recognize that this is not a political issue. This impacts all of us. And so we should all be concerned about these proposed cuts.
Yes, couldn't agree more. How does research funding support both jobs and local communities?
Yeah, that's a very important issue, is that not only does the research funding support the new investigations, but also it supports the local economies. For example, in the state of Utah in 2024, there was $307 million of NIH funding into the state, which supported over 4,400 jobs. And it is estimated to have resulted in $836 million of economic activity in the state. So not only does it support the research, but also local economies.
Yes, so crucial and critical. Okay, all the information is at the bottom of your screen if you want to visit the website. Doctor, thank you for all you were doing. Great to see you. Thank you for joining me today.
Thank you so much for having me.